You're listening to Inside the Village, where all news is local and no topic is off limits.
So help me, Bob, it's bully in the alley. Hey, bully in the alley. So help me, Bob, it's
Back for another episode of Inside the Village across the Village Media Network and wherever you get your favorite podcast with Michael Friscolanti, our editor-in-chief here at Village Media. I'm Scott Sexsmith. It is Saturday, the 10th day of May. Welcome back to the program. Good to see you.
As well, you?
I'm excited. Golf season starts today.
Yeah, starts today.
Yeah.
You have your clubs all shined up.
My clubs are shined.
Ready to go?
Spit polished.
Are you a good golfer?
I'd say average.
Yeah?
Yeah.
So you're not good then. No golfer's really any good.
Well, I mean, some are, but those guys are on TV. I will guarantee this.
You're on TV, right?
Well, there's that, but you will never see me swinging a golf club on TV and getting paid for it.
That's next week's episode.
Next week's episode. Speaking of episodes, we've been off for a couple of weeks since the interview with Prime Minister Carney when he was in Sault Ste. Marie.
Yeah, that was a great chat. Super exciting to be able to do that. Just so everybody kind of gets a feel for how those things come together. As you can imagine, the PMO has lots of requests for interviews, for questions. The Prime Minister's office, as the Prime Minister travels, gives you regular media availability to the reporters. And that day at Algoma Steel, a massive, pretty big contingent of busloads.
It was huge.
2 busloads or one
Yeah,
busload?
two coaches.
Of national journalists were following around. It was only 3 days before Election Day, so
Right.
there were all the newspapers were there, the major broadcasters were there. And because of your diligence and your persistence over a couple months, we were able to land 20 minutes with Prime Minister Carney. So after he did his press conference at Algoma Steel, Zach, Drew, and Ethan, our production guys, had 5 seconds to set up a table and a bunch of cameras, and it went off without a hitch. It was fantastic. It was funny how there wasn't even a table for us to set up, and like the Prime Minister was around the corner coming.
I know.
And we were getting, but it all worked out. All came together. I felt super at home. For me, it was kind of a moment for me because going through university, I worked at Taylor Steel in Hamilton.
Right, yeah.
All around coils. I built skids for coils. I moved coils around with forklifts. I spent 5 summers. It was a great experience. I love the guys I work with there. And then 25 years later, to be sitting around a bunch of huge coils of steel talking to the Prime Minister was pretty amazing.
And if you've never been in a steel plant, and obviously you have, the heat coming off those coils
it was something.
was crazy.
It was something. We were a lot sweatier than it looked
Oh,
like. Well,
I mean, I sweat
maybe
at
we
the-
always look sweaty.
I sweat at the best of times.
Yeah.
And you've got 105-degree heat
Yeah.
coming off those things at least.
It was pretty fun. It was right on Carney's back, right? He was right. His back was right up against the coil.
Yeah.
You could feel
Now,
that.
he's a little thinner than us, so,
I think
you know.
he's in a lot better shape. But it was a great conversation, and like we say, we invite all the leaders to come on this show.
Yeah.
We're happy to have these kind of conversations. We did ask Pierre Poilievre's campaign to have the Conservative leader come on. They didn't respond to us, which is too bad. I would have preferred to have spoken to both of them. But it was our second Prime Minister that we've spoken to. We spoke to Justin Trudeau back last fall.
Yeah.
So let's hope that the streak continues. I think our viewers enjoyed the conversation.
Yeah, and it's a great point, and we've been fortunate. Justin Trudeau late October, Mark Carney a couple of weeks ago. I mean, there's a horseshoe somewhere that's stuck, but we're okay with that because it's been good.
Yeah, and I think sorry to cut you off.
No, go.
But I think we got to ask him a lot of the questions. A lot of questions that were on people's mind going into Election Day, and I think it was not that we throw around page views, but by far, in terms of YouTube, our YouTube channel, we've never seen an episode go off like that one did.
Absolutely. By the way, search Village Media on YouTube and feel free to subscribe there. Cheap plug. Okay, we're going to talk measles on the program. Quick update on Dave Bennett, remember?
Yes.
A few weeks back?
Yes.
Days 63, 64, 65, still in the Dominican. Update, though, charges have now been dropped, and they're waiting to process some paperwork to bring Dave back home to Canada, to Burlington.
That's crazy that you have the charges drop. I don't know what's keeping him stuck there, but I'm sure that's a bit of a happy ending. Certainly a happy ending for the family, but I'm sure they won't feel 100% happy till he actually lands on Canadian soil.
Of course, and I know that Jane Wilcox and the rest of Dave's friends and family will be excited to see him back on Canadian soil. Okay, measles running rampant across certainly Ontario, but other parts of Canada as well. We're going to talk about that today.
Yeah, it's every day the numbers are getting higher, not just across Canada, but in Ontario as well. And a lot of questions about whether the provincial government is handling this the right way, whether they're giving people enough information. There's a lot of mixed opinions on that, but definitely people have a lot of questions, right, Scott? Because this is a disease that was eradicated 30 years ago. And the idea that we're in the middle of a measles outbreak in Ontario is kind of shocking. It's a great way to put it. So we're going to speak to someone who knows this issue well, is going to help us understand a lot.
Absolutely. Dr. Zahid Butt joins us from the School of Public Health Sciences at the University of Waterloo. That's next when Inside the Village returns right after this.
When you need a mortgage, the right choice can really save you money and stress. With True North Mortgage, you'll get your best rate, better options, and timely advice to help you save thousands. Bring home your best mortgage today with experts you can trust.
Welcome back to Inside the Village across the Village Media Network with Michael Friscolanti, our editor-in-chief. I'm Scott Sexsmith. Well, measles back with a vengeance. Although the disease was eradicated over 30 years ago, Ontario now in the midst of an outbreak that really once seemed unthinkable. At last count, Frisco, I think over 1,200 infections have been recorded. 84 people have been hospitalized, including 63 children. People have a lot of questions about what's happening. And you know what? So do we. And to help us answer those questions, we're pleased to be joined today on the program by Dr. Zahid Butt, a professor in the School of Public Health Sciences at the University of Waterloo and an infectious disease specialist. Doctor, thanks so much for being here today. We appreciate your time.
Thanks for having me.
All right. Before we get into some of the specifics, Doctor, can we start with a bit of a refresher? Just so everyone is clear, what is measles? A lot of people have the misconception that it's a minor childhood infection. Can you set the record straight for us?
First of all, it's not a minor childhood disease. It's a highly contagious disease. On average, a person who is infected can infect 12 to 18 susceptible persons or people who are unvaccinated. It can result in complications such as pneumonia. It can lead to brain inflammation, it can lead to deafness and blindness. And in some cases, it can also lead to death.
Yeah. Do you hear that sometimes, doctor, that people are downplaying how serious this is? Like, oh, measles, it's not that big of a deal.
Well, I think the reason is that because people haven't really seen measles now, as you mentioned, that measles was eliminated quite some time ago. So that's why they don't realize that this is a serious disease, and you can end up with complications. You can also end up in the hospital. I think that's one of the reasons, and I think the reason is the success of public health and vaccination. That's why you don't see a lot of measles cases out there, but now you are seeing those outbreaks.
And maybe we'll get into that. We'll speak a little about that. Is the fact that fewer people are getting vaccinated the big reason why we're seeing this outbreak, or are there other things at play here too?
Well, that is the major reason here, because people are either not getting the vaccines or they are kind of under-vaccinated, so not taking the 2 doses of the measles vaccine.
And what are the current vaccination rates in the province, doctor? Are they 70%?
Well, I think I did not check recently, but I think they are not around 95%, which is expected to basically stop the transmission of the virus.
And doctor, this is a tough question, but why? Why are vaccination rates down from 95% a generation ago to where we are now, whatever they are? They're much lower.
I think there are one of the reasons we just discussed is basically when the disease is not there, people become complacent about vaccination. So they think that it's not a serious enough disease to get vaccinated. The other reason is because there is some sort of vaccine hesitancy regarding measles vaccines, as well as when we are just out of the pandemic period and people are kind of having that, I would say that vaccine fatigue, that they say, well, we got the COVID-19 vaccines, but now maybe we shouldn't get the measles vaccine or some sort of thinking like that. And the other thing is there's a lot of like misinformation on social media about measles, and that's probably affecting people's decisions, as well as people's decisions about their children regarding measles vaccination.
Definitely a lot of misinformation. We've talked in the past about, people linking vaccines incorrectly to autism, and that's you still see that if you Google it. Yeah. That's the first thing that comes up. Yes. How frustrating is that for you, doctor? And is there any way, is it even possible at this point, the way the world works, the way the internet works, to debunk that misinformation to the point where you would get people back up to 95% agreeing to get vaccinated?
Yes, well, debunking does take a lot more effort than basically when people spread misinformation, but it needs to be a continuous, persistent kind of effort to debunk these sort of misinformation about health issues, especially measles. So you need to be really active on social media platforms. You'd really need to collect with people on social media or even other media so that they are able to understand the disease, they are able to understand that there is a vaccine to prevent it. So you need to be really active in terms of media as well as really active around public health communication.
Doctor, let's talk for a second about public health officials and whether or not they're doing enough. There's been some criticism. In fact, earlier this week, the health minister, Sylvia Jones, held a press conference, and she's saying the province's plan is working. I guess the big question is to you, is it really working?
So, for looking at whether any program is working or vaccination is working, you have to look at trends. So if you are looking at trends and you're seeing that the disease cases are stabilized or they are decreasing, then you know that really something is working. Now, in terms of public health communication, well, you have to come on media to explain to people that, like, let's say, starting from what is the disease, what can be done to prevent the disease, what we should be doing in the community. So that messaging has to be there. Uh, Obviously, it's not a pandemic kind of yet, so you don't see those regular weekly meetings or even daily that we had during the pandemic. But it is still important to come on media and use different media channels. Come on the news. You can go on the news. You can use social media platforms. You can have maybe some sort of public health campaigns around measles. And I think in that sense, your family doctors and other public health officials can play an important role.
Doctor, you said it's not the pandemic, but let me ask you this. Does it have the potential to get there? I mean, when COVID started, everybody was saying, in 2 weeks, this will be done. Is there that same possibility?
Well, there is a possibility. Obviously, it's there in Europe. It's there in North America and other countries as well. But I think the advantage that we have now is because we have a vaccine that is very effective. It gives you a lifelong immunity if you get vaccinated, and so that's an advantage we have now. We know a lot about this disease that we did not know about COVID-19.
Fair.
It's interesting what you mentioned about the vaccine fatigue, the pandemic fatigue,
Yeah.
right? I assume we have to imagine that if the pandemic never happened and people weren't inundated with messaging about vaccines, we wouldn't see this dip that we're seeing now. But when you speak to people individually, doctor, who say the same thing to you, say, you know what, I'm tired of hearing about the government and public health officials pushing vaccines on me. I don't want to do this anymore. How do you try to counter that on a one-on-one? What do you say to people?
Look, so some of the things I would tell them is basically, look, this is a disease that can be prevented. It's just 2 doses. Once you get those 2 doses, you're protected in your life. So basically, it's a lifelong thing, right? You don't have to get the vaccine again and again. So I think that's a pretty convincing thing. The other thing is you can talk about historically, talk to them about the disease. You can talk about what are the complications that you can get from the disease, and you can show them, look, this is why you don't see a lot of measles cases in your community. It's all because of the work of those vaccines, and you can be part of the process. So basically, I think it's more about talking about the differences between different diseases, talking about the differences between different vaccines, and basically talking about collective responsibility, because the disease can spread very fast, and
Yes.
you are helping us in basically stopping the transmission of the disease. So I think it's a matter of having that conversation with people, because what I've noticed is it's all about how you present your information and giving the right information and being clear and transparent about everything.
Doctor, do you find it personally frustrating? Do you shake your head sometimes? Because I look at it like this. I'm not a scientist, obviously, I'm not a doctor, but some very smart people figured out a way to eradicate this terrible disease with vaccines. They figured out a way, and it must have been a moment of mass celebration, I would assume, when that happened. What an amazing accomplishment. And now you, a doctor, sees what's happening in the world now, where you have a lot of people who don't know anything about that saying, well, I don't want to take that anymore. Is that personally frustrating? Do you shake your head sometimes, just throw your hands up in the air?
Well, I think uh, it's a continuous battle, really, right? It's not so you would see these things coming up. So I think it's more about understanding where that person is coming from, because that's what we are here for, right? We are here to basically prevent these infectious diseases from coming. So at times, it does feel like, yes, people need to understand it, but then we also need to understand where people are coming from.
Hmm.
So I think it comes with talking with people, spending time with people, so that you understand these things. So I don't think that it's about more about frustration. It's about basically continuing the battle against certain diseases.
Yes.
Obvious question here, Doctor, I think, but what kind of strain does an outbreak like this put on our healthcare system that is already at the brink of overload?
So that's a good question. You have to realize that when these outbreaks happen, they have to shift their resources in terms of combating these current outbreaks. So basically, people who are working in public health, they have to basically then prioritize these stopping the outbreak and doing contact tracing and giving vaccines. So it basically takes them from the routine task. And as you said, there are other health issues as well that are occurring at the same time. So they have to basically then take care of everything, which is not possible because you have this outbreak. You need to control this. If you don't control this, it will spread even more. It could go to other provinces. It could cross borders as well. So that's where it creates this burden on the healthcare system, which is already burdened by other health issues.
That's definitely an important point. I do want to ask about school suspensions as well, Doctor. This is something in the headlines. I believe where you are in the region of Waterloo, they've just suspended 920 children today, I
Right.
believe, or yesterday, in the secondary school students. Obviously, public health has been warning about this for a month, that if you, don't have your vaccination, if you don't have your vaccination records up to date, you could be suspended. And just to be clear, that means that you're either vaccinated, or B, that you have the exemptions that are allowed, whether it's on a religious,
Right.
medical exemption or religious or conscious decision. I guess I just wonder, first of all, Doctor, is that the right strategy? Do you think the suspensions is a pretty blunt instrument, but is that the right strategy here?
Well, I think in terms of emergencies, that's something that we are facing now. That's something you have to do. Ideally speaking, you would be screening these children when they are entering into the school system, or basically even when they are on the waiting list, for example, to enter into like schools or other places. So I think now, because they are there, now you have to do something, because if you don't get them vaccinated, the disease will spread very fast. It's very difficult to control. Just
Mhm.
imagine, like, on average, like you could say, like 15 people getting infected, 15 children
Mhm.
getting infected, and then they go home. Let's say if their parents are also not vaccinated, then their parents will get infected. So
Mhm.
in terms of that, yes, uh, it does seem cumbersome on patients, but in the bigger picture, you'll have to do certain measures. Otherwise, it's very difficult to stop the spread of this disease.
I guess for me, where I struggle is we're at a point now. Let's say there's 70% or only 60% of people getting vaccinated. So the school system or the public health unit will have 60% people with a vaccine record saying they've got their vaccine, and another
Yeah,
40% with some kind of exemption.
yeah.
I wonder at what point is it even worth keeping track of these
Exactly,
records, because
yeah.
it's just not there where you need it to be.
Well, I think if you look at the records, you will see people don't have that many exemptions. It's basically more about people who are on the fence on giving vaccinations to their children,
Hmm.
or people who are not convinced. The exemptions are not a lot, actually. Well, fortunately, in Canada, they are not a lot. So if you reach the 95% coverage, then you will see that the outbreaks will you won't see the outbreaks. You'll see the cases declining. So that's what the region is hoping for when they do all the suspensions and other measures.
It's interesting, right? I do find it very fascinating, doctor, because you can have a medical exemption, like you said, or you can go online and obtain what's called a statement of conscience or religious belief exemption, which must be signed by a commissioner of taking affidavits. You have to get somebody to sign it. And under this scenario, parents must watch a vaccine education video. So I'm assuming the hope is that when people go down that road, they might get these parents in front of the TV and they'll watch this and say, okay, this is a dumb decision.
Yeah.
Is that working, do you think?
It's possible that but I think maybe you would need more of a concerted public health effort here, not just like asking them to watch a video, but maybe connecting with a family doctor or somebody who can explain to them the reason why you need the vaccine. So I think that's where the effort should be as well, like public health communication. How do you communicate to people who have these exemptions?
Do we happen to know, just out of curiosity, Doctor, what the percentage of exemptions are? Any idea? I don't want to put you on the spot, but
I don't have an idea. Probably the region has an idea, so
Yeah.
they would be the best
Okay.
people to connect with.
Let's travel quickly south of the border, if we can, and talk about the consequences of having somebody like Robert Kennedy Jr. as the U.S. Secretary of Health and Human Services. What's the impact there?
Well, if you look at the news, what's happening there is because of the misinformation around the measles vaccine. You're seeing a lot of more outbreaks in the U.S. and I believe that probably some children have died as well in the U.S. because they were not vaccinated. So you're seeing those. You will see that the cases will rise, and you are seeing really this effect of misinformation on vaccine uptake due to measles.
I want to ask you about our Chief Medical Officer of Health, Dr. Kieran Moore. He gave an interesting quote, at least it was interesting to me, in the Globe and Mail this morning. He said that he's been very sensitive to the fear that we created at the beginning of COVID, and I really this time want a more balanced approach. Okay. I can't imagine as a public health professional what the right balance is. How do you find that balance between having zero media conferences or news or interviews with reporters talking about the issue and having too many?
Well, I think this would be based on like your experience with putting out these messaging, but finding the right spot. I think it also depends on how fast the disease is spreading as well. If you're seeing the disease spread a lot and you're not seeing really cases declining, then obviously you need to come on media more, because then you need to explain to them. But if you're seeing that, looking at everything, looking at trends and statistics, and you're seeing the cases are declining, then maybe you don't need to create that the hype around the disease. So I think it's just a matter of like how you balance it with the current evidence. How do you balance your public health communication with the cases that are occurring?
For sure. Doctor, I really appreciate all the time. I just have a few more questions if it's okay. I appreciate it. This is a really interesting, hopefully intelligent conversation. I guarantee you, Doctor, I'm going to get emails from people saying, you're a terrible journalist. You didn't uncover the truth about how dangerous vaccines are and how they're killing everybody.
Yes.
So, Doctor, what do you say to these people who will say to me or to you that these vaccines are so dangerous, they're going to kill me? I can't believe you're pushing vaccines on me.
Well, they are not. So the one thing is that if they want to look at that, they can do their own research. They can look at.
They're doing too much of their own research, Doctor.
Maybe
that's part of the problem.
Yeah, so I think they're not they're not looking at I would say, the right research, or they're not really looking at. Look, if you do a simple calculation, you could see that like how fast this disease can spread, right? Like if we tell them like, look, if this one child can infect 15 other children, and then those 15 other, each of these 15 other children can infect 15 other people. So that's how fast you will see that everyone is getting infected if you're not vaccinated. And I don't think there have been any reported cases of death that are related to the measles vaccine. It's possible that there are certain deaths because of other causes, but you can see that you will see over time that you're not seeing those sort of deaths due to vaccine. And another thing about the measles vaccine, it's been there for quite some time. I believe in Canada They started that in 1963. So if there were a lot of deaths, let's say from this vaccine, you would have seen that, you would have heard that, or you've seen that occurring quite frequently. But that's not the case. So, so I think it's, as I said, when getting the right information is very important, like in terms of understanding any disease.
Thank you for that, doctor. In all seriousness, what's your worst fear with this outbreak? What's the worst case scenario? We're gonna, I mean, the nightmare will be that we start seeing lots of children dying of measles in Ontario.
Yeah, not only dying. So you see, so that's one part, but you could see a lot of children having like brain inflammation. That's not a very good complication. That's a complication. You could see them having deafness or blindness. So that's a disability as well that you're seeing. And death is basically at the end, but during that time you could get all these complications, and that's not very good. So I think that's the thing people need to think about, that it's not just getting the disease, but you might result in having these complications.
Doctor, before we let you go, is there anything else that we didn't ask you or touch on that maybe you'd like our audience to know?
No, I think we did touch on a lot of points. Yeah.
And a lot of good information, just for the record. Credible information. There's Dr. Zahid Butt, a professor at the School of Public Health Sciences at the University of Waterloo. Doctor, we truly appreciate your time today. Thanks for the information and the chat.
Yes, thank you so much for having me.
When you need a mortgage, the right choice can really save you money and stress. With True North Mortgage, you'll get your best rate, better options, and timely advice to help you save thousands. Bring home your best mortgage today with experts you can trust.
Back to wrap on Inside the Village. Okay, history lesson. The first measles vaccine, 1963, Dr. John Enders. Then there was an update in 1968.
Yeah. So like, was it a better vaccine that came out in
1968? It was a better version, a new and improved Maurice Hilleman in 1968.
Could you imagine the party they had when these guys discovered and figured out a way to eliminate measles?
Crazy.
To see, like, think how many kids were dying in the decades before that of measles, right? And these guys, with all their brain power and the beauty of science, figure out, we found a way to eradicate. We're going to save millions of children's lives. You'd toast to that. You'd have a big drink.
At least one.
And they must look down now.
And now, right, 1963, 1968. Now, fast forward to 2025.
Yeah.
Do you think those fellas ever would have thought that? How many years later?
Could you imagine they woke up from the dead and they go on Facebook for the first time? And
Yeah. What is this Facebook?
This podcast getting out of control. We've gone over the edge. But it's nuts to me that you could accomplish something so meaningful, and then decades later, it's like, nah, these idiots are wrong. They're stupid. What do they know?
Because I read on the internet.
It's just it's insane to me, right? Why strive to do anything that's important for the world, because people aren't going to believe it anyway.
Yeah, crazy. Anyway,
this podcast isn't even real.
It is not.
It's all AI generated.
Yeah.
Inside.
Do not give the powers any ideas.
Yeah.
Okay. Dr. Zahid Butt, I think he debunked a lot of myths, some wonderful information, credible information. And it's nice to have a conversation like that where
I appreciate it. We always say we try to have intelligent conversations on this show. All right.
How we're here is still a mystery.
I know.
ITV at villagemedia.ca. Questions, comments, concerns, anything at all. We'd love to hear from you. ITV at villagemedia.ca. We're back next week with another installment of the program. We hope you will be too. Enjoy the rest of your weekend. Thanks for watching.
You've been listening to Inside the Village.
Frisco and Scott's Wardrobe, provided in part by Moores, Sault Ste. Marie.